I am 71 years old, still working, and I love painting and playing guitar.
I've been a cardiac electrophysiologist for 13 years, and I've been practicing at Mercy General Hospital here in Sacramento for the duration of that time. So I met Joyce under very unusual circumstances. I first met her when she was researching atrial fibrillation for a documentary that she was shooting.
And found out that AFib is one of the #1 reasons boomers end up going to the emergency room. I thought, oh, this is a good story. And I searched for the best of the best to interview, and Dr. Ariana's name came up. And I had him scheduled for an interview on Wednesday, and this was Friday. And I went into AFib.
Atrial fibrillation, also known as AFib, is a type of heart condition that can cause irregularity in the rhythm of the heart, which leads to quivering or fibrillation of the top chambers of the heart. This in turn can then give rise to conditions such as a stroke, heart failure, heart attack, and hospitalizations related to these types of conditions.
I knew I was in trouble, and I just told my husband, I said, you need to take me to the hospital. I need to go. There was something I knew that felt so awful.
Common symptoms include palpitations or rapid heart beating, irregularity in the heartbeat, chest pain, shortness of breath, dizziness, lightheadedness, and even feeling faint in some cases.
It was 11 o'clock at night, and I'm sitting in my hospital bed, and I'm shaking my head, and I'm thinking, how did I end up here? I saw a doctor in the hall. Is that Dr. Ariana? Well, yes, it is. I said, nurse, call Dr. Ariana. And he said he would not do it. I screamed out, I go, Dr. Ariana! And he stopped in his tracks, turned around, looked, walked back, and he goes, Joyce Mitchell, you're not supposed to be here. You're an AFib. I go, tell me about it. I said, get me out. He goes, only if you become my patient. I said, done deal. I'm your patient. Get me out of AFib.
And I had, of course, the pleasure of taking care of her. The treatment options include medication therapies, such as blood thinners to prevent stroke, and also medications to treat the rhythm of the heart, as well as the fast heart beating in some cases. But medication therapy has never been shown to be a definitive treatment option. The definitive treatment option consists of ablation. It is a safe procedure during which small noodle-like catheters are placed through the veins into the heart to map and ablate or eliminate the sites and spots that are driving the arrhythmia. And Mercy General Hospital here in Sacramento is the single largest cryoballoon ablation program in the world.
I was anti-ablation. I was not going to have anything done. I was very adamant about not doing it, but the medicine made me so sick that I was back in his office and I was losing weight. I was just not doing well. And he said, well, you have the choice now. You could have the ablation. And it was a difficult decision and one I did not take lightly. And I said yes. It's nerve-wracking to think about your heart being looked at and worked on, but it was pain-free. The recovery was very easy, and it changed my life for the better because I didn't have to live in AFib or live with an unpredictable heart, and I didn't have to live on medicine. So I did the story, finished the documentary on a Friday, and I think it was the next Monday I had my ablation. Took a month off and went right back to work to do another documentary. I'm a secure person with my heart. I'm as active as ever. I just kind of love life.